Hi, Michelle here, physical therapist, and welcome to 2-Minute Table Talk. The question today is, should I go home after my knee replacement surgery or to a skilled nursing facility? Well, I'm here to tell you, if it's me, I am definitely going home, and there's 3 reasons for that. And the first one is bugs. I know, these don't look like actual bugs, but bear with me. Let's just pretend. All right, you have things like the common cold, the flu, pneumonia. Those kinds of things will be much more prevalent in a skilled nursing facility. Not that you can't encounter them in the community, but they're definitely more prevalent. You have a bunch of immunocompromised people, and yourself, you will be, after surgery, somewhat immunocompromised. And so you do not want to put yourself near these guys. Now that's not even to mention, we're just talking about common critters. You have staph infections, and then you have the grandpappy is the MRSA, which is a really bad staph infection, and it's resistant to most of the antibiotics that we use to treat a staph infection with. So if you can, and here's the thing, in a perfect world, you may say, well, Michelle, I'm going to a 5-star rated skilled nursing facility and everything's going to be fine. And that's maybe okay, right? Everyone who goes to a skilled nursing facility does not get sick. That's true. But remember that you're putting yourself in a position where in a perfect world, everybody, washes their hands before they go room to room. The workers, if they're sick, they don't come in from outside and treat you. And visitors who are coming to the nursing home, going by in the room, or you having to be seated next to somebody at a table eating lunch who is sick, or going on a treatment table to get therapy, and then right after somebody who's been sick. So again, much more higher likelihood. I think personally, if it's me, I want to go home to my own bugs and I want to stay away from the skilled nursing. Now, secondly, is control. So in your home, you can eat your own food that your body likes. If you want to stay up late and get up, sleep in the morning, I've had people tell me that they woke up in the middle of the night and they wanted to do their exercise because it made them feel good. Well, that's great. But in a facility, you're going to have much less control. And I think, personally, of all that, it's going to be kind of stressful anyways. So go home to your own environment where you have maximal control over what you're doing. All right, now thirdly is progress. You're going to be further ahead. Now, why do I say this? Well, you really don't need to be waited on for 10 days. So some people, they kind of like that. And if you do allow that, I think you're going to take longer to recover. In fact, I know you are. So I kind of tease my patients when I get them at home health after they come from a skilled nursing facility, and I say, what were you doing at Club Med for 10 days? Because actually I can get them further along if they come directly home to me. And so anyways, those are the 3 reasons: bugs, control, and progress. Now you may say also, Michelle, I don't have anybody at home. So, I'm a widow, or my husband works, my spouse works, my kids work, and I don't have anybody to be there. Well, really, here's the thing. Just cover the first 24 to 48 hours, because that's when you're going to need it the most. The biggest hardship is when patients come home and they're transitioning from the meds that you would get in the hospital to oral meds at home. And that can be a little rocky. But if you survive that, you're going to do fine. You just need to make some meals ahead of time so you can get up, you can reheat something pretty easily, you can put some soup on, make sure you get a 4-wheel walker or a walker with a little platform so you can carry your food from the eating area into where you sit to eat, the dining area. So you won't have to have somebody there 24/7. You can do your icing, you can get your leg up on the bed. All right, so if at all possible, go home. Remember, bugs, control, and progress. You'll be further ahead. All right, that's been a 2-Minute Table Talk, and we'll see you on the next video.